One, and we are live with Mr. Rob Moore. Mr. Rob Moore, how are you this fine afternoon?
I'm doing great, Kelly. Yourself?
Another day in paradise, Rob. Another day in paradise.
Yeah.
You look like you're ready to be done for the day.
It's been a good day, a long day. But
You have a lot of long
days. You, Kelly. It's a good way to end the day.
Yeah, I can see how that would be. Yeah. Hey, with the finals, with the Timberwolves out of the finals, will you watch the finals between the Dallas Mavericks and the Celtics?
I will not stay up late like I did with the Timberwolves game.
Timberwolves.
I'm not a late person. I like to go to bed and get up in the morning. But if it's on, I'll watch it. I'm a little down on it.
Yeah, I can see how that would be. You're a fairly big I would consider you a big Timberwolves fan.
Yeah, I like home teams.
Well, I get it. It was interesting to go to the game that I went to. The Timberwolves played so hard compared to when I watched them before, and I'm not a basketball person, so this is just an untrained eye, but they played so hard compared to other years I've watched them. And they were diving on the floor, and they were doing other, they were trying equally hard and really battling, as we say in the hockey biz. But they didn't have Kyrie and Donicic.
Luka.
What's the?
Luka.
Yeah, they those two guys just could take the game over at points.
Yeah, they definitely were better than us in the series. So.
Yeah, they're better. So let me share my screen with you because I want you to see what e-prescription, what they tell me about e-prescription. Can you see my screen?
Not yet.
Oh, that's disappointing. Let's see if I can do it. Here, how about this? No, we can. So when we look at e-prescribing, because the question was asked to me, what is e-prescribing? And when you look at the definitions, it says e-prescribing enables a prescriber to electronically send an accurate, error-free, understandable prescription directly to a pharmacy from the point of care. Your doctor, I'm assuming. It's an important element. That just seems to me like you're taking the doctor's bad handwriting out of it. I'm assuming there's more to e-prescription than that.
Yeah, I mean, you're hitting on the base level, right? The ability to send just one well-formed script from point A to point B. The handwriting is actually a big deal, right? Because the handwriting could, when you talk about the SIG, all the directions on there, that can be misinterpreted. And then the possibility for forgery, right, as well. So that
I guess
you take that out of the equation. So that's the new RX. But e-prescribing, I think when people talk about e-prescribing, it encompasses not just the script side of it, but all the supporting transactions around it. And just as important, the benefits and cost side of it. So predetermining cost, making sure the patient doesn't walk into the pharmacy the first time and realize they can't afford the med because they weren't informed by the physician that it was too expensive, stuff like that. I think that's where there's a lot more value. Well, I don't know. The script itself is extremely valuable, but the supporting transaction adds a lot of value as well.
Yeah. Is it integrated with your insurance company or with the government insurance that you're using? Is that how it's determining what you call formulary? The fancy word for, is my prescription actually covered by my insurance?
Yep. Yeah. The Surescripts type of integration, and other places can do it as well, but it's providing connectivity to the pharmacy benefit management company, the PBM, which handles it's the payer for the pharmaceutical side. It's direct connectivity to them. So they're giving you, tried true pricing information for a particular drug for your particular plan, where you are on your deductible, what's out of pocket for you, all that specifics now. It's pretty nice.
And who will give us some examples of who are pharmacy benefit management companies for people who don't know?
Well, the big ones is, Prime Therapeutics, Express Scripts, CVS Health. Those are the big ones.
Okay. And we get calls, your group gets calls, and we do a lot of integration related to Surescripts.
Right.
How is Surescripts different than the PBMs like Express Scripts?
Well, Surescripts is nothing like it. I mean, Surescripts is a technology company. They're not they do healthcare, but they're a technology company. They provide connectivity. So when Surescripts or RxSub back in the day started, there was a need for the PBMs to be able to communicate with the EMRs and the pharmacies. And they didn't want to do one-offs. They didn't do one, there's too many of them to do those individual connectivities. So you put Surescripts, was RxHub, in the middle of that. They're the hub to reach all the spokes of all the different connectivity. And it enforced the use of standard ways to communicate with each other. So, now one PBM can talk to all the EMRs instead of trying to just talk to the big ones. So think of them in the middle.
Yeah. And you say the EMR, these acronyms for some people, are we talking about actual software products like Epic and Cerner as an EMR?
Yeah.
Is that what we're talking about?
Yeah, just any type of tool. And specifically for this space, it's the prescribing tool a clinic will use. It's whatever tool. It's typically within their full electronic medical record or health record. It's usually within that system, but it doesn't have to be. It's the part that actually writes the prescription is what we're talking about here.
The part that writes the prescription.
Like you said, it's Epic. It's, that was the big one. In Midwest, it's Epic.
Yeah.
So.
Well, you know what? It's more than Midwest because I was in California having a conversation on a beach, and I bumped into someone from Stanford Health, and everybody's using Epic.
Yep. Yeah, it's a big one. And so where we get involved is usually with the players that are not the Epics. They might have a unique solution for prescribing. They might have a unique type of pharmacy need. Like we're wrapping up one that's around compound meds, which the Epics of the world and the other big EMRs don't necessarily do a great job around compounds because they're more complex and they're a small percentage of overall prescriptions, right? So where we come involved is we'll work with those niche vendors or vendors that maybe be using some other company as a pass-through to do the prescribing. We do the customized interface that they can now own and not go through, a transactional fee with an Epic or a Dr. First RxNT type of solution. I've done a lot of work around there. So it's custom integrations with Surescripts is kind of our strongest.
That's a common. And so, and the reason you mentioned the reason is because we're able to provide we build a custom application or interface or all of the above that helps the company avoid having to spend the transactional money of going through an Epic or a Cerner or whatever the EMR is. Is that right?
Yeah, exactly. And what also makes it valuable to that player is that it's totally fully integrated. It's not like a framed approach where you're in their app and you hit a window into someone else's app or anything. It's totally integrated into their prescribing tool, this prescribing interface. And then they don't have to work through another vendor, for licensing.
Yeah. Who are the kind of people that reach out to us in Logisolve's e-prescription group? I know the state of Florida reached out to us, so we do state work. But who are the other kind of customers that reach out to us?
Yeah, the last couple. Well, there's a couple different examples. The last couple that, in fact, I'm talking to a client, a potential client next week, where they have their own EMR that they've been using for years, and they're integrating with another, it's happened to be Change Healthcare that for their prescribing part. Well, things that happen with those, you're relying on another vendor. Change had some issues recently, and all of a sudden if they have issues, then you have issues. So what they want to do is they want to remove that dependency on them and have us build the interface with Surescripts so they're not dependent on another vendor. That's the probably most often is that they have an RxNT or a Dr. First or a DoseSpot or Change as their vendor in the middle that they want to remove. It's complex because there's a lot of those vendors do a good job. They have a lot of information, a lot of functionality, but what we can do is help them integrate it directly into their tool, not do it. The other big one is when people have unique solutions, like I mentioned with compound meds. They wanted us to write a full prescription writer that could do well-formed compounds. Because if you think about it, a typical script is for one drug. And most EMRs, they allow you to pick a drug and write a script for it. This one had to be able to pick 4 different ingredients for that particular drug at their own, quantity, strength, and, units within there. And then the instructions on how to combine it to send it to the pharmacy that way. That's 2 examples.
Yeah, and I'm hearing more about that kind of script related to the Monjurnos and some of these drugs that are helping people with diabetes or weight, and they're having to compound custom made kind of prescriptions that go to a compound pharmacy that are then, they add the ingredients and that ends up as the final drug that the person takes. So it sounds like, in my world, I've heard recently of people I know that have had to go that route because they couldn't get Monjurno or some of the others that I can't remember the names of them right now.
What happens today with the current EMRs, a lot of them, is that the physician has to kind of freehand all that information into like a note of the script itself, because they don't have the ability for their system to put it into the discrete elements of the transaction. And then you lose the value of and something else that's been big for us is there's additional work and certification you have to do around controlled substances. And so some companies are coming to us to help us implement the technology to be able to do controlled substances, because there's additional two-factor authentication, credentialing, all that kind of stuff. And then also, as you can imagine, in a compound drug, if you're sending 4 and one of them was a scheduled, you want to make sure you catch that one, because you cannot send it just in the notes field because it didn't identify it as a scheduled med. So you're breaking the law by sending a script that's not fully vetted.
Yeah, interesting. And so, I know we're SOC 2 compliant. Your group is SOC 2 compliant. Right. Does that play into our ability to work with these Schedule 2s and more quote unquote regulated drugs that are prescribed?
Yeah, direct and indirect. So we've jumped on the SOC 2 bus, one, because it's a good idea to really lock up your systems that way. But whenever we have a solution that utilizes that we maintain and house through a cloud service, but are responsible for PHI, for protected health information, we need to be SOC 2 compliant. We did that on our hospital side, which you covered many podcasts on that. And now that we have that across that line, we found the ability to now work with some of these vendors that maybe want us to maintain their connectivity within our cloud platform. And we wouldn't be able to do that without being SOC 2 compliant.
Okay. I want to go back because we were talking about some of the states contact us to help with their e-prescribing and integration of their healthcare different platforms. But then you mentioned another company that's calling because they want to have their own solution to avoid working with an EMR like Epic or Change Healthcare, for example. What kind of company is that? Did you? I don't know. Did you say that to me and I missed it? But who is? What do they do for a actual business? The company that's called that is wanting to control more of that process.
Yeah, it's I think more often it's some sort of mid to larger provider that at some point developed their own system, their own EMR.
Oh,
so they have their own approach, and the only reason why they work with Dr. First or Change or something like that is because that's how they quickly got into the prescribing without figuring all that work out. And now that it was a good idea, and it still is a good idea for some companies because it's quicker, but you give up the flexibility of making it look like what you want to look like. You give up, you start paying licensing fees and transaction costs, and it gets deeper and deeper. And so it's a company that type of client is typically either they have, it's usually their own homegrown system, because most of the vendors that are strictly EMR vendors, they've already do e-prescribe.
Yeah, but they're a provider. They're hospitals, clinics, pharmacy, companies. Okay, good. Well, Rob Moore, thank you so much for your time. End of the day, you're always busy, and so I appreciate you taking time to talk with me.
Not a problem. It's always a pleasure.
Thank you very much for that, Rob, and for everyone else out there, you are watching the vodcast.